Bismillahirrahmanirrahim. Dear media colleagues and followers, welcome to our press briefing from WHO Regional Office for the Eastern Mediterranean to brief you on the highlights of the 72nd session of the Regional Committee. And as we mark 2 years of the war in Gaza, we will also share updates on the health situation and ongoing health response in particular. Glad to welcome our speakers today, Dr. Hanan Balkhi, WHO Regional Director for the Eastern Mediterranean, Dr. Adham Ismail, Director of Program Management, Dr. Annette Hazelman, Acting Regional Emergency Director, Dr. Richard Peppercorn, WHO Representative in Occupied Palestinian Territory, and Dr. Aziz Abu Aisha, Head of Emergency and Preparedness Department in the Palestinian Red Crescent Society. And actually, today we are running this briefing, as you see, in English with Arabic translation. English is live streamed on Emro X account and Dr. Hanan Balkhi's X account. Arabic is live streamed on Facebook and YouTube. Those colleagues who are joining on Zoom can select the language by pressing the button of translation. And of course, there will be a chance to live questions. So when the chance is there, please just click the button or write on the chat. To begin, I'm pleased to give the floor to Dr. Hanan Balkhi, WHO Regional Director, for the opening statements. Dr. Hanan.
Shukran, Muna. Thank you so much. Dear ladies and gentlemen, thank you for joining us today. Today's press conference will preview the 72nd session of the Regional Committee. But first, I want to talk about Gaza. In September, I attended the high-level international conference on the two-state solution at the UN General Assembly, co-chaired by the Kingdom of Saudi Arabia and France, which highlighted a positive way forward to ending this tragedy. There has been significant progress toward the recognition of the State of Palestine, and advancing the two-state solution would greatly improve our ability to open humanitarian corridors and ensure the sustained flow of aid into Gaza. I hope that this initiative and the momentum among the member states will continue to move forward. And now, 2 years after the war in Gaza began, we see at last a glimmer of hope, and its end might be in sight. But when the fighting stops, a new struggle will begin to rebuild Gaza's shattered health system and rescue an entire population from the edge of famine and despair. WHO has been planning for this day after the conflict, the day after, and we now have a clear vision of where and how to move forward. We will need to move quickly from crisis response to recovery, because building Gaza's health system will not only save lives today, it will restore dignity, stability, and hope for the future. First, we need to get hospitals working again. 14 of the 36 hospitals are functioning, but only partially, with dire shortages of electricity, clean water, and medicines, as well as broken equipment and damaged infrastructure. Some facilities have been hit and rehabilitated more than once. WHO, which supplies all the fuel that powers hospitals and ambulances, has delivered 17 million liters of fuel, keeping surgeries, neonatal care, and vaccine cold chains running to the best of their abilities. But far, far more is needed. Essential supplies, from antibiotics to wound dressings, must reach every part of the Gaza Strip without delay. At the same time, we must confront hunger and malnutrition, which already too late when Palestinian health authorities report that 455 people, including 151 children, mostly under 5, have died from malnutrition since January. Over 500,000 people are trapped in famine-like conditions, and more than 1 million others are severely food insecure. 7 in 10 pregnant and breastfeeding women are acutely malnourished. 1 in 5 babies is born underweight or premature, and infectious diseases are surging. WHO and partners are supporting the remaining stabilization centers that treat severely malnourished children and working to open new ones. But lasting recovery means rebuilding food systems, restoring clean water, and strengthening sanitation, the foundation of public health. Of Gaza's 176 primary healthcare centers, only about a third remain partially function. We must urgently rehabilitate all primary healthcare facilities to restore the backbone of public health: vaccination points, maternity clinics, pharmacies, and mental health services. Mobile teams and field hospitals must continue serving displaced populations until permanent facilities reopen, and hopefully soon. Gaza's doctors, nurses, paramedics have endured exhaustion and loss. Over 1,700 health workers have been killed since October 2023. Those who continue to serve need protection, pay, and psychological support. Rebuilding Gaza's health system must start with its people: training new professionals, restoring medical and other health related schools, and bringing home those forced to flee. Restructuring the health sector will be costly. Over $7 billion split between humanitarian response and early recovery and longer term needs, but this investment is essential for the peace and stability that health can bring. Donors must provide both emergency aid and address immediate humanitarian needs and flexible, predictable, multi-year support that rebuilds infrastructure, strengthens local capacity, and allows Palestinian institutions to lead a recovery that is inclusive, transparent, and sustainable. And when we rebuild, we must build back better. Gaza's health system must be more resilient, equitable, and sustainable than that before the war. Hospitals should be powered by renewable energy, clinics equipped with clean water systems, and health information networks modernized to track outbreaks and guide planning. Though every bombardment and blackout, WHO has stayed and delivered in Gaza. WHO has been the main provider of medicines and medical supplies, supporting over 22 million treatments and surgeries. We have coordinated medical evacuations of over 7,800 critically ill patients out of over 15,000 in need. And we have co-led immunization campaigns that protected 600,000 children from polio. We stood by Gaza's health workers, and they had nothing left but courage, and we will continue to stand by them. WHO stands ready to support the day after response and the recovery of Gaza's health system by restoring core services, strengthening the health workforce, and rebuilding a resilient, people-centered system for care. Now to next week. Next week, health ministers, policymakers, and regional health leaders will gather in Cairo for the 72nd session of the Regional Committee for the Eastern Mediterranean, RC72. We will celebrate our many achievements while also addressing this moment of extraordinary challenge for global health. Conflict, climate change, economic fragility, and unprecedented humanitarian crises have converged to place health systems under extreme strains. Cuts in foreign aid threaten to deepen these pressures, with the full impact only beginning to surface. The Regional Committee will offer countries a platform to deliberate on urgent technical issues and on the political choices that will shape the region's health future. The agenda combines immediate life-saving priorities with long-term reforms, anchored in the Regional Strategic Operational Plan and 3 flagship initiatives on access to medicines, health workforce, and substance use. We will also review and deliberate on 4 technical papers and associated resolutions, and as well a launch of a regional consultation process on climate change and health. Ministers will consider a draft resolution to have the members of zero-dose children, those who have never received a single vaccine, by 2030, while also committing to eliminate rubella and congenital rubella syndrome. Between 2019 and 2023, 12.6 million zero-dose children were recorded across the region, mostly in conflict-affected and displaced communities. Each child represents a preventable tragedy, a life at risk from measles, polio, and rubella. This resolution is not just a technical milestone, it is a political statement that every child deserves protection. A second resolution will call for palliative care to become a core part of national health systems. Today, only 1% of the 2.4 million people in need of such care each year in our region actually receive it. Millions, including cancer patients, children with congenital conditions, and refugees with chronic illness, continue to die in avoidable pain. Expanding palliative care is a question of dignity, compassion, and equity. With 16 concurrent emergencies and more than 115 million people in need of assistance, the Eastern Mediterranean carries 1/3 of the global humanitarian caseload. From Gaza to Sudan, from Yemen to Afghanistan, health systems have been apart by war, climate shocks, and economical collapse. A new resolution will call for health system recovery to become the foundation of resilience, ensuring that humanitarian response goes hand in hand with early investment in rebuilding services, restoring trust, and laying the groundwork for peace. Laboratory safety has long been a blind spot in regional health security. Weak governance, fragmented oversight, and insufficient training leave facilities vulnerable in accidents or misuse. Ministries will discuss during our RC72 frameworks to close these gaps, protect health workers, and strengthen the role of laboratories in surveillance, diagnosis, and preparedness. And finally, we will tackle the health impacts of the climate emergencies in the Eastern Mediterranean, from dust storms, extreme heat, floods, water scarcity, and others, are reshaping the health landscape and compounding vulnerabilities. Building on the Global Plan of Action on Climate Change and Health adopted at the World Health Assembly earlier this year, RC72 will launch a consultative process for a regional operational framework on climate and health. This will be regionally owned, context-specific roadmap to make health systems climate resilient, equitable, and future-ready. It will strengthen surveillance and early warning systems, climate-proof health facilities, mobilize equity-centered financing, and establish a new regional climate health observatory. Ministers will also be invited to endorse a call to action on breast cancer, the leading cancer among women in this region. Beyond these headline issues, participants will discuss a range of technical and governance matters, including preparations for the next executive board. We will review the ongoing transformation process, examine health financing priorities, and highlight progress in polio eradication. The Eastern Mediterranean region has much to show the world in its solidarity, courage, and innovation, and these strengths will come together at this year's Regional Committee. WHO remains committed to helping member states achieve real results for health and equity across the Eastern Mediterranean. I invite you all to follow the proceedings of RC72 live on the WHO EMRA website and social media channels. And now I give the floor to Mr. Aziz Abu Aisha, who graciously joins us today and head of the Emergency Preparedness Department of the Palestinian Red Crescent Society. Dear Mr. Aziz, over to you.
شكرا جزيلا. السلام عليكم. طبعا بداية نتوجه بالشكر على إتاحة هذه المنصة لرفع صوتنا باسم العاملين في الميدان الإنساني ونقل صورة الواقع الصحي والإنساني الكارثي الذي يعيشه سكان قطاع غزة منذ أشهر طويلة تحت الحصار والعدوان المستمرين. منذ اليوم الأول للحرب تعمل طواقم جمعية الهلال الأحمر الفلسطيني في ظروف استثنائية وصادمة من حيث الخطورة وسط القصف المكثف والانهيار شبه الكامل في المنظومة الصحية ومن دون أي ضمانات للحماية أو المرور الآمن. ورغم التزام الجمعية التام بمبادئ الحياد والإنسانية وعدم التمييز، إلا أن المنشآت الطبية والطواقم التابعة لنا كانت هدفا مباشرا ومتكررا للهجمات والحوادث. حتى اللحظة استشهد أكثر من 54 من كوادر الجمعية، من بينهم 29 استشهدوا أثناء تأدية واجبهم الإنساني في الميدان، وأصيب 42 آخرون بجروح متفاوتة، كما وتم اعتقال 27 من موظفين ومتطوعين أثناء تنفيذهم مهامهم الطبية والإغاثية. لقد فقدنا زملاء وهم يرتدون زي الإسعاف ويحملون شارة الهلال الأحمر الواضحة المعترف بها دوليا، في انتهاك صارخ لكل القوانين والقواعد والأعراف للقانون الدولي الإنساني. كما تعرضت منشآتنا الطبية لهجمات متكررة، حيث القصف الذي تم لمستشفى القدس في مدينة غزة أكثر من مرة وأدى إلى محاصرته وتوقفه عن العمل عنه. وفي جنوب محافظات غزة تعرض أيضا مستشفى الأمل التابع للهلال الأحمر الفلسطيني في مدينة خان يونس لهجمات متكررة أجبرته على الخروج عن الخدمة أكثر من مرة، وذلك بعد تعرضه للاستهداف المباشر وتعرض محيطه وتضرر بنيته التحتية الأساسية، رغم وجود مئات المرضى والنازحين خلال تلك الهجمات داخل المستشفى. إن هذه الهجمات تمثل انتهاكا صارخا وممنهجا ومتعمدا للقانون الدولي الإنساني، وتؤكد الحاجة الملحة لتدخل دولي فاعل لحماية الطواقم والمرافق الصحية. على الصعيد الميداني خرجت 49 مركبة إسعاف عاملة في الجمعية بشكل نهائي عن الخدمة نتيجة الاستهداف المباشر والمتكرر، كما وتم تقليص قدرة الجمعية بشكل كبير على الوصول للجرحى ونقلهم في الوقت المناسب. في ظل شح الوقود والإغلاق الكامل للمعابر واستمرار الحصار المفروض على قطاع غزة، تواجه الجمعية تحديات خطيرة في تشغيل ما تبقى من منظومة مركبات الإسعاف والمستشفيات والمراكز الصحية، مما يهدد بانهيار كامل للمنظومة الصحية والإنسانية. رغم هذه الخسائر الفادحة، تواصل طواقم جمعية الهلال الأحمر الفلسطيني أداء مهامها بشجاعة نادرة والتزام إنساني راسخ، لتبقى صوتا للحياة والأمل في وجه الموت والدمار. إن حماية الطواقم الطبية ليست مطلبا فلسطينيا فقط، بل هو واجب إنساني وأخلاقي عالمي لا يحتمل الصمت أو التأجيل. في الختام، نتقدم بخالص الشكر والتقدير لزملائنا في منظمة الصحة العالمية ولجميع شركائنا في الحركة الدولية على جهودهم المتواصلة في دعم النظام الصحي الفلسطيني ومناصرة العاملين الصحيين في الميدان، وتوفير هذه المنصات الدولية لعرض معاناة المدنيين والعاملين الإنسانيين في غزة. إن هذا الدعم المعنوي والمؤسسي يساهم في تعزيز صمودنا واستمرار رسالتنا الإنسانية في أصعب الظروف. شكرا لكم.
شكرا جزيلا الأستاذ عزيز أبو عايشة. Thank you very much, Mr. Abu Aisha, for your statement, and thank you, RD, for the opening remarks. And now moving to the questions and answer, I remind media colleagues that the chance there, if they have questions to raise, just click on the hand button. And allow me to start with a question to you, RD. You mentioned actually that there is a glimpse of hope regarding Gaza, and you attended the UNGA actually session on this, on the subject of the two states, and actually this what created maybe the hope that there is a way forward. What our WHO is actually doing to prepare for the next step? And of course, in addition to what you mentioned in the statement.
Thank you, Mona, and thank you for this specific question. Of course, yes, indeed, it was a nice moment to be in New York and at the UNGA at the session of the two-state solution, because I think it definitely gave a glimmer of hope and a sense of us moving forward, which is very positive. I think also there's a feeling that this needs to move forward in the fastest way possible, and that we need to work together. Of course, all agencies are going to be working together. The WHO part on this, and we'll have Rick come in as well, is that WHO is leading the health component of the damage and needs assessment. And many of our donors continue to ask us about what are the hospitals that will require renovation, how are we going to move forward? So that assessment part, we are very much engaged with. And we're working with partners also to assess this damage and finding out the prioritization for restoring essential services, and also plan for the long-term rehabilitation. Also, the rebuilding of the health system will mean that there needs to be reconstructing of facilities. Once the ceasefire is established and fully established, I think we're going to have to understand and identify what is the status of the healthcare facilities at that time, which ones of them can be restored, and which ones of them need to be rebuilt all over again. What type of field hospitals that can be assessed. There needs to be also an assessment as the overall health agenda on the housing, the water sanitation, the energy provision, and a lot of those other issues. So it is going to be tedious, it's going to be intersectorial, and it has to be done within the collaboration of all entities. And I'm very proud and thankful to the teams on the ground, the WHO teams, but also all of the other UN agencies that have been working together hand in hand to move this piece forward, and to always be mindful, even in the midst of the conflict that has been going on. Over the past 2 years, there has not been a moment where we have not been thinking together about the day after, and how will we make this happen immediately once the ceasefire is established. So this is just the overall approach that has been taken by WHO and the UN. And I would like to hand it over to Rick for any specifics.
Thank you very much, Dr. Hanan. Let me try to be brief on this one, because it's such a huge topic. First of all, greetings from Gaza, and I'm currently actually in the Al-Amal Hospital from the Palestinian Red Crescent Society, and actually assessing and visiting, and WHO is a partner in their rehabilitation support. I will get back to that later. I'm sure we get some questions on that. But let's first say that currently in Gaza, everywhere where I go, and I've been in Gaza City just a couple of days ago, and here in the south, everywhere. So people live between anxiety and hope. Currently, I have to unfortunately say there is no ceasefire yet. When we were in Gaza City only 2 days back to Al-Ahli Hospital, bringing in the most needed trauma supplies, IV fluids, saline, IV antibiotics, but also some lab equipment and food for patients, the staff, etc. Bombardments and strikes were all over the place where we were. We saw a constant stream of trauma patients, horrific trauma patients, young girls with severe burn wounds, boys gasping and pneumothorax, etc. So we are counting, and currently we talk about more than 67,000 people killed. And then I don't include the thousands under the rubble, and we don't include the indirect death. It will be much higher. and more than 170,000 people injured. So we all agree, and I think this is where everywhere where I speak, any Gaza will say, will tell me, we don't care about the plan. We want a ceasefire, and we want to know, and we want to move forward. Now, just to say something about, I think the RD alluded a lot to early recovery and rehabilitation and recovery and reconstruction. I'm glad she did. So currently, WHO is already focusing on 4 pillars of support. The first pillar is essential health services, and essential health services is everything related to primary health care, referral care, but also all medical supplies, essential medicines, medical supplies, and equipment, including the support to emergency medical teams, with doing fantastic work, and the medevac. It's all part of essential health service. The second component, second pillar, is the public health intelligence, I think described by the RD as well. Think about polio, think about health information systems, epidemics. The third pillar is coordination, more than 73 partners, and WHO is leading the one UN and partners in health, more than 73 partners only in Gaza. And the fourth pillar, which we all hope would be the biggest pillar by now, is early recovery, rehabilitation, reconstruction. Yes, we have been part with government on doing the assessments, and RD mentioned the figure of 7 billion, which is even an underestimation in health. We're making plans because but the situation is constantly changing. I want to say one thing: over the coming years, there will be an absolute need to continue with the humanitarian support, but we indeed have to rapidly expand anything related to early recovery, rehabilitation, and reconstruction. WHO is ready for that in health. We are ready for that with the partners. Maybe later I can give you a small example in the area of rehabilitation. Over to you.
Thank you, Dr. Rick. And actually, I have a question to you, Dr. Adham Ismail. The question is, with the multiple crises in the region, how does WHO ensure the continuity of funding of its health programs, and prevent their interruption? The question is from Mona Eid, الأهرام الاقتصادي, and Mustafa Hajjaj, آخر الأنباء.
Thank you, Mona, and thank you for the colleagues who posed the question. You know, following the leadership transition in 2024, WHO initiated a series of strategic reforms to ensure that our health programs remain impactful and uninterrupted, even amid growing geopolitical volatility and public health challenges. These reforms have focused on maximizing efficiency and agility through internal restructuring to streamline operations, country-level human resource reviews, to also increase our footprint on the ground to better align staffing with priorities, and cost-saving measures like increased digital engagement and reduced travel. Since January, maybe 2025, we've also embarked on a journey to address the challenges posed by the potential US cuts to our organization. We've undertaken a comprehensive prioritization exercise and undergone an HR realignment process to ensure that our resources are directed where they are needed most. This has allowed us to match available funding with program and staffing needs, giving us confidence in our ability to deliver on our mandate throughout the coming biennium 26-27. In parallel, we've responded to the regional crisis and the withdrawal of major donor by intensifying our efforts to diversify funding and adopt innovative operational models. These actions are all part of our commitment to safeguarding the continuity of essential health services and building resilient health systems, as mentioned by the regional director, even during conflicts across the entire region. Thank you, Mona.
Thank you, Dr. Adham. And we have Lina Nashapef. It seems that she has a question. Please let us know which outlet you are representing and to whom you want to address the question. Thank you. Lina? Can you hear me? Please unmute yourself. Lina. Okay, we will move to another question till Lina is ready. I have a question to Dr. Annette Hanselman. Dr. Annette, the question is about Sudan. Sudan has recently completed a large-scale cholera vaccination campaign. Lina, are you back? Okay. So it's about Sudan, and as I mentioned, Sudan has recently completed a large-scale cholera vaccination campaign amid ongoing conflict and displacement. Can you tell us more about WHO's role in this response and what more is needed to prevent further spread?
Thank you very much for this question. Maybe allow me very briefly to make some comments about the general situation in Sudan. So Sudan currently is facing the biggest humanitarian crisis in the world, with almost 30 million of people in need of humanitarian assistance and almost 20 million of people in need of health assistance. This is almost half of the population in need of health assistance. We are also seeing in Sudan the biggest displacement crisis in the world. 10 million internally displaced people are mostly living in precarious living conditions and shelters without access to safe water and sanitation, and with very limited access to health care. The health system is very much fragilized by this situation, and only 60% of the health facilities are mostly only partially functioning due to the attacks on healthcare, due to damaged infrastructure, and due to the fact that a lot of medical staff has left the country. When it comes to the cholera outbreak, which was declared in 2024, we have seen more than 120,000 suspected cases and about 3,300 deaths, which represents a case fatality rate of 2.8%. And this is by far above the international standards and really shows the problems of the healthcare system to struggle with, to cope with the situation. With regards to the cholera vaccination campaign, since the cholera vaccination started, WHO has supported the Ministry of Health together with Gavi and UNICEF to carry out these campaigns. More than 20 million people have received vaccination, and the current vaccination campaign are in the difficult to access areas in the Darfur states. The ongoing campaign targets 1.8 million people in extremely complicated operational conditions. And there is another vaccination campaign planned, mostly in West Darfur, which will start shortly and will target another about 600,000 people. It is important to say that vaccination is not a solution for cholera outbreaks. You need safe access to water and sanitation. You need access to medicines, to health facilities. So WHO is delivering medicine, pre-positioning medical supplies in all affected states. And we are also strengthening the disease surveillance and rapid response capacities. What is the main challenge for this response is the lack of adequate funding. We, us as WHO, but also all the health sector, is only funded currently at 30%, and this means that millions of people will continue not to have access to the health care they deserve. Thank you.
Thank you, Dr. Annette. And we have Sami Magdi from Associated Press with us. Sami, please unmute yourself and raise your question.
Hello, this is Sami from the EP. I have actually two questions, one on Gaza City and second is in Sudan, specifically on Al-Fasher. which is in Gaza City, we have seen like doctors going for weeks that operations there on the brink due to prevalent shortage of medical supplies and fuel. My question is, could you shed some light on the overall situation in the city? And is WHO able to deliver the required supplies? And what are the restrictions you face to deliver medicine and medical supplies? Also, how about the malnourished children who are still in Gaza City? Are you able to reach them with the required medicine? And second question is in Sudan, does WHO have like figures about malnutrition related deaths and family related deaths in Darfur, specifically in Al Fasher? Are you able to contact people there?
Okay, thank you. Thank you for your questions, Sami. And we'll start with Dr. Rick for the part on Gaza City, followed by Dr. Annette for the Fasher in Sudan.
Yeah, thank you very much. A very important question. And by the way, just as we speak, the microphone was closed. So we are now in Khan Yunis. We had a strike nearby. So I think that's what I just want to say. The ceasefire is unfortunately not yet there. We absolutely need it. And I completely agree. There's a glimmer of hope. Everyone wants any plan to work, but it's not yet there. This is when I come to Gaza City. Gaza City, where we estimate there's still between 200 and 250,000 people in Gaza City. So when we went there, we saw no movement from both north to south as from south to north. Very few vehicles. We were the only one. We were very much welcomed. And it's that we were this mission. We went to Al Ahli Hospital, and I said we delivered. Al Ahli Hospital is a private, it's actually a mission hospital. Only 40 beds, now many more. And Al Ahli Hospital, together with the PSCS Field Hospital in Gaza City, Soraya, are the only two partly to minimum functional hospitals, and the only two hospitals where there is some level of trauma care. Even at Al Ahli Hospital, most of the senior staff have left. So that's the situation. The question was, are we able to bring in supplies? We did bring in supplies, trauma supplies. We brought in, but also IV, antibiotics, lab supplies, and some food for staff and patient. Now, Shifa Hospital, which used to be the biggest, by far the largest hospital in Gaza City, and myself, before this crisis exploded, coming to Gaza every month, since the crisis, actually from November, December 23, every other month. I was there again 6 weeks ago, Shifa. Then it's still at 600, over 600 patients, no more, 1,200 patients, almost at 200 to 300% the bed occupancy rate. Currently in Shifa, more than 90% of the staff have left. The only unit which is minimal function is a dialysis unit, and there is what we call a trauma stabilization point. So Shifa is basically, it's not even minimum functional. That's how it is. So only 2 service points currently in Gaza City. We try to supply as good as possible. The question was also related to malnutrition. That's more complex for us. We are not the only one. We do that together with UNICEF. We have a problem getting the nutritional supplies into Gaza related to the very few treatment centers. There used to be 8 treatment centers. Now there's less than 4 of this treatment center, and none of them anymore in the north of Gaza. What else did we do? I mean, just talking about this week. Besides that, we medevac. It was supposed to be medevac for sick neonates from Al Hilu Hospital. One of the neonates unfortunately passed away in the night before, so we medevac the 3 to the south because that hospital is not be able to care for that as well. We also did a medevac last week, Monday. We want to do more. I just want to stress, I think, because Dr. Anand was alluding to the ceasefire, and I think we all We all want that. And when we start with recovery, one thing I want to raise, WHO has been consistently raising with regard to medevac. And the current, we medevaced 8,000 patients. We had assisted 8,000 patients, excluding a companion. However, that's a massive achievement, but there's still 15,600 patients on the list, of which almost 4,000 children. Oh, we want the last medevac was for 180 patients and companions. We want to expand. We are ready to expand to 3, 4, 5, 6 medevacs per month, for example. But what would really be a little game changer if we open up the traditional referral pathway to the East Jerusalem and the West Bank. Now, we've been consistently lobbying for that, and I think Dr. Hanan can also allude to that, because at the General Assembly, a group of countries stood up, etc., and they first did this through silent diplomacy, and now they've made it very clear they also want this to happen. And when there's a ceasefire, the East Jerusalem, West Bank being part of Palestine, we should get that back. Why do I say that would be a game changer? I think we can make sure that a couple of thousand patients can be actually transferred there to East Jerusalem and the West Bank. And then the most complex patients, we want more countries to open up. I really want to praise the country in the region, in the Emro region. I mean, I can mention many of them, but think about Egypt, the UAE, Qatar, Oman, well, also Turkey, etc. Europe is now finally starting to open up. We need to push much harder on that, and it needs to be a concerted action and a comprehensive approach. WHO is also ready to support the hospitals in East Jerusalem and the West Bank. Of course, we will need flexible resources for that, but we are ready to go. Over to you.
Thank you, Dr. Rick. I know that you need to leave, so any questions regarding Gaza, we can take it now. Sorry, Annette, we'll delay this, the Sudan question till we receive another question on Gaza. We have Ashvin. And Ashvin, if your question is on Gaza, please raise it.
Thank you. Thank you for considering my question. What strategic plan WHO East Mediterranean or WHO have to restore the attainable health of Eastern Mediterranean region, especially in the Palestine region, and what WHO have plans to mobilize human resources to challenging humanitarian aid supply, as well as restoration of hospital especially in Palestine and Gaza state.
Ashvin, what's your outlet, media outlet, please? Can you tell us?
This is Ashwin Barshinge from Observer Times, India.
Thank you. Dr. Rick, the floor is yours.
I think maybe the RD also wants to speak to this a bit. So first of all, the plans I think are pretty clear, and I think RD alluded to that also when she spoke about the General Assembly. Whenever there's a ceasefire, to our understanding, and very quickly after, Egypt, with a number of other countries, will organize a Gaza conference on early recovery, rehabilitation, and reconstruction. We have to think much broader than just health. I mean, the destruction is everywhere, massive, and we have to focus at all sectors. What you would expect when there's a ceasefire, that first of all entries are open for humanitarian assistance. Currently, we really struggle to get still up till now the supplies in, and we struggle still even in health, for example, to get specific supplies in. So that is the first step. The humanitarian support can be massively expanded as soon as there is a ceasefire, and the UN is ready for that. I want to remind everyone, when there was a temporary ceasefire, January, February, the UN, including WHO leading on health, etc., within 2 months, we brought in a substantial amount of supplies. The food became more diverse. There was a glimmer of hope, and situation was changing. We don't want a temporary ceasefire anymore. And this, so based on this conference, I think we are looking forward to a much more comprehensive plan for Gaza. But I also want to look at the smaller things. And just let me now look at what did we now already do on early recovery and rehabilitation in this crisis, besides all the humanitarian support we described. So we did already work in these 2 years, for example, assisting hospitals with expansion. Nasser Medical Complex, where we expanded with a field hospital. We did the same in other hospitals. We are planning to do the same here in Alamal for rehabilitation. We restored a number of, helped to rehabilitate a number of primary healthcare centers, etc. And if you allow me, I want to also stress in this 2 years mark, and I'm sure the EMRO colleagues will share that, WHO came out with a couple of very critical papers. One was on injury and rehabilitation needs in Gaza. And that's where I'm sitting now in Alamal hospitals. If you talk about rehabilitation, I mentioned the figure that 169,000 people have been injured. WHO did an assessment review last year, together with the EMTs, but now did a much broader review with much more data. The shocking conclusion is that one critical result is the same, that 1/4 of this 169,000 people will have life-changing injuries. And so 1/4, that's more than 42,000 people, of which more than 10,000 are children. Now, over 5,000 of these people have faced amputation, many of them children. We see other severe injuries, arms, legs, etc. I'm here in Alamal, which is the only hospital where you have in-services rehabilitation services for only 40 patients. Going now to Nasser Medical Complex, where there's an OPD, etc., but not with specific inpatient rehabilitation services. So currently, WHO is helping to expand PRCS with a field hospital focuses on rehabilitation, and also with a fixed hospital, which is already ongoing. Those are small rehabilitation efforts. However, when the ceasefire, we have to look at this, it's a much larger way. We have to relook at the core primary healthcare, and then the hospital infrastructure. There used to be 36 hospitals in Gaza. I had a discussion with the minister in Ramallah as well on this. Like, do you want to go back to 36 hospitals? Or do you want to focus to a number of, let's say, definitely in the north, we need a 3-level referral hospital in the center and the south. Then you need a group of general hospitals, but then you need a primary healthcare network, which are linking to that, and community health. We have to think much more creatively and specifically in topics as mental health. How do we integrate that at the various levels? What is the role of NGOs, etc., and communities? Then I think RD alluded to the more larger infrastructural work, etc. Yes, plans are in the making, but I think plans will have to will be changing, I think, over time. One small thing I want to mention is on the humanitarian area. A key asset we need, and I think also RD mentioned, is fuel. We still limit fuel in Gaza. Without fuel, no hospitals, no health facilities, etc. And the UN need a pooled fund for fuel, which should be readily available and consistently available, because otherwise we cannot even continue our humanitarian support. Over to you. And by the way, I still have 15 minutes. Over to
Okay, thank you, Dr. Rick. Dr. Hanan.
Yeah, thank you. I would like to thank also this specific question. Again, it comes to the core of what we've been discussing at global level among all of the UN agencies, among the 3 level of the WHO, transformation and reform. And Dr. Adham gave a little bit of a focus on this in his answering the first question that he had. But I think it's very important that we put things in perspective. The reality is, with the current funding shortages, it's going to be much more difficult for us to do what we had aspired to do in all of the services that we provide our member states, whether it's from emergencies to the other thematic programs. However, at the same time, it also is a great opportunity for us to start focusing more on innovative financing, which we've created a regional innovative financing task force that will work among members of this region. We've also been focusing on linking health with economy. And that's where the first flagship and the second flagship focus on what are the biggest burdens of diseases in this region? What is it that we need to do to reach to our aspired SDGs by 2030? And how are these flagships going to focus on filling those specific gaps? So it's a very good question that you ask. And it is looking at the whole health instead of looking at health as a burden, is how do we look as health as part of an investment for the countries. So I think we will be discussing this in much more detail at RC72, and please stay tuned for further work that we're doing on the whole access initiative, where we are working. It's a very complex matrix of strengthening research and development in the region, in enhancing proper digitalized warehouses at regional, sub-regional, national, subnational levels. It is looking also into the essential medicines lists at the country level. It is looking into enhancing primary healthcare and UHC. It is also looking into strengthening the regulatory authorities so that we can have better oversight on the local production capacity that has been a great appetite for many of our member states, including Egypt, Morocco, Jordan, UAE, Saudi Arabia, Iraq, Syria, Lebanon, even Yemen and Sudan and Afghanistan. Almost every single country in this region is keen on enhancing one or multiple pharmaceutical production or nutritional production entities in their countries. We are very keen on the regulatory and the oversight to make sure that these productions are pre-qualified, they are safe, effective, and affordable. On the affordability part in the whole access initiative, we have already partnered with our colleagues in PAHO and moved forward the pooled funding concept. And we hope within the end of this year and early year, we can speak more about where we've reached on that aspect. So there's a lot of work that we're doing. There's a lot of energy within the region, a lot of three-level collaboration within WHO. And through the Regional Health Alliance, we're also doing a whole lot of collaboration and partnering to be more complementarity among the UN agencies so that we can, through our presence at country level, we can support all of this effort. So thank you very much. And I think that same question will now go to Annette for Sudan. Thank you.
Exactly, yes. Pasher, Darfur. Yeah.
Yes, thank you very much for the question about Al-Fasher. So yes, we are in contact with health staff and health authorities in Al-Fasher itself. And overall, the health situation in this besieged city is really very, very concerning. So there is an increase of malnutrition cases, of trauma cases, and also of infectious disease cases. Currently, there is only one health facility, the obstetric hospital, which is still functioning and has to struggle with a limited number of staff, shortages of life-saving medicines and medical supplies, and also, as it's the only hospital, with limitations of surgical and inpatient capacity. With regards to trauma cases, trauma is a major issue. Trauma treatment is a major issue in Al-Fasher. Since the beginning of the crisis, there have been more than 15,000 trauma cases. And just to give you a more recent example, in the week of the 14th of September, there were almost 500 trauma cases which needed treatment in Al-Fasher. With regards to the question of the malnutrition, since January, there were about 10,000 children with severe acute malnutrition which were treated in Al-Fasher. And in the region or in the surrounding of Al-Fasher, for example, in Melet locality, where a large part of the people which are displaced from Al-Fasher are living, There are currently malnutrition rates of 34.2%, which is a record high since the beginning of the conflict. So altogether, a very, very situation. WHO, we are ready to go into Al-Fasher as part of a UN convoy, bringing in life-saving medicines, medical supplies, and vaccines if safe access can be granted and there is accessibility for a UN convoy. And if there are further questions on more details, we are happy to answer by email. Thank you.
Thank you, Dr. Annette. And a question to you, Dr. Adham. The question is about the resolutions adopted by the regional committee in previous sessions. The question says that they are always important, but how can they be translated into concrete action that makes a real difference in people's daily life? The question is from Mona Eid Al-Ahram Al-Iqtisad.
Thank you, Mona. Thank you both Monas actually from here and from Ahram Al-Iqtisadi. I think this is a brilliant question because that was also one of our concerns. And by the way, it's a side event during our upcoming RC72. Let me just give you some numbers regarding the number of, we've had 3 consecutive studies on the number of resolutions produced from the year 2000 to the year 2019. 236 resolutions have been produced by the regional committee. And unfortunately, we had to sunset almost 72% of them. 65 only remained. And there were different factors that contributed to this. Maybe the text of the resolution was a bit aspirational, more than really pragmatic on the ground, as the question alludes to. And maybe also some external factors like conflicts, and COVID and many other things. So yes, the question is very much valid, and this year, or maybe especially if I go back last year in the RC71, we've introduced a number of important changes to the regional committee cycle. All of these changes had one clear goal: to deepen member states' engagement and strengthen their ownership of both the process and the outcomes of the regional committee resolutions. So this year's agenda, for example, and I really invite everyone to come and attend this year's, which is a landmark of change in the way we do business. This year's agenda is firmly rooted in technical matters that were proposed and selected by member states themselves, ensuring strong alignment with national priorities and a greater likelihood of implementation at the country level. They've selected them, so they should be implemented. We've also taken a proactive approach by consulting member states early in the summer on each technical paper, allowing them to shape the content of the resolution from the outset. One of the most significant shifts this year is that our sessions will no longer focus on presenting the papers, but instead on discussing the resolutions in depth, if they are pragmatic, if they are feasible, if they are doable. This creates space for meaningful dialogue with the ministries of health and their delegations, fostering a full buy-in and commitment of translating these resolutions into real action, as you alluded. Thank you so much, Mona.
Thank you, Dr. Adham. And actually, this was the last question for today. Apologies for colleagues media colleagues who shared or sent questions and time didn't allow to answer to them, but we will try our best to answer by email. And special thanks to all our distinguished speakers and Mr. Aziz Abu Aisha, who joined us today from the Red Crescent in Palestine. Until we meet again, stay safe.
Thank you, everyone. Thank you so much.
Okay, thank you all. And
thank you, Rick. Take care.
Yeah, yes. we just for your information, we just had a second strike very close by. So it's really, unfortunately, it's for me insane. You think it would stop, but it still doesn't stop. Yeah, so let's all pray and hope that this goes on, that this will really change over the next couple of days. For your information, I will have a discussion together with the Israeli authorities about this European Gaza hospital and something else. What we don't want, we want to, of course, make sure that in the north, that operations somehow will continue. We don't want to be facilitating even more of expulsion over the last couple of 100,000 people from the north to the south. So I think it's and I'm sure that my colleague Abu Aziz can allude to that, etc. Because that's I think the Soraya Field Hospital and together with Al Ahli are the only two hospitals which are still partly functional. But anyhow, we will follow
Thank
up.
you very much. Thank you, Rick.
Bye-bye.
Thank you. And I want to thank Mr. Aziz again for being with us and for elaborating on all of the efforts that is also by the Palestinian Red Crescent, and thank all of the journalists online with us and all of those who are following. There's a lot happening in this region, so please continue to follow us on our social media accounts. Take care, everyone, and see you later. Bye-bye.